Hi, this is Dr. Lorn, and I am going to give you a brief demonstration of how I do low back bodywork. Of course, this is assuming that you have ruled out significant causes that would make doing bodywork contraindicated. So we are going to be looking at working the muscles, but only in a scenario where we have ruled out that there may be bone fragility or ruptures or anything serious that would obviously clearly warrant that you don't do any kind of muscle or fascia work. And of course, that means, having someone go over the condition to make sure that having body work done is something that can be done without risk. So that being said, I'm going to go over QL muscle in terms of how I approach that particular low back muscle. In this case, obviously, I am aware that you can do low back muscles, you can do glute muscles, you can do IT band, you can strengthen the core muscles, and in some cases you can even work on the front, such as the psoas and other types of trigger points or fascial release. But in this case, we're talking purely about the low back muscles close to the vertebrae. So let me show you that. Okay, so as I was saying in the video right before this, what we're looking at here is QL muscles. Now, many times I have wedges I'll actually put under the asses in the front to lift up so that you actually get a little bit of a passive stretch. And then depending on the side, so let's say it's the left side, so using like a traditional method, you'll find a point that's sore, right? So you are pushing either into, I don't like to push straight down because many times that creates more pain, adding to the pain that's already here. So I'll actually go in. Now, some people will say that they don't like that idea because it's pressing towards the vertebrae, but as long as you're not doing it like too aggressively, it actually works really well. So this is what I would do, and I'll actually work up to the insertion, which usually in these scenarios is extremely sore. And so you want to release that. So we press it, we hold it, and we have them breathe, and you wait, and you wait, and you wait. Sometimes it's a few seconds, sometimes it's minutes, and you wait until it releases. Now, I used to use fingers a lot for this, but in what I would rather do is put passive weight on it. So a lot of the time I'll use a forearm and I'll sit there and hold it. But what I'm not putting all my weight in. I'm angling it in this way, and I'm actually many times I'll hold down the pelvis on the bottom so that it doesn't push forward and rotate forward. And then I'll keep the stretch on until it releases. And then I'll move and I'll find the next one. Okay. This is very effective if you don't overdo it, but you have to hold it and wait for it to release. If you don't wait for it to release, generally speaking, it's going to hurt more. So you want to wait until it releases, then find the next spot and lean into it. But I like to keep a stretch on it. Or keep pressure down on the bottom side of the pelvis so that it doesn't rotate forward. And then, of course, that reduces the efficacy of what I'm doing. And you just hold it till they tell you it releases, or it's down to like a 3 out of 10. And then you look for the next spot. And you can get really good releases on it that way. I'll work all the way down here, and I may also use my forearm here and go. It's just easier that way. If anybody who's been doing body work for years, using fingers, thumbs can be exhausting on your joints. So, and then if this is the side, then I will have gone over, if there were any issues with the glute muscles, we would address it. If there were any more issues with erector muscles, we would address that. If there were issues with the IT band running down to the knee, obviously we would address that too. So that's just a very basic way to approach these. And you're talking about a very short area that you're working. So basically from the ilium up to the bottom ribs where that attachment is. If you get a release on that, you're almost guaranteed to get relief in the lumbar down to the sacrum.